Good morning. I'm Muriel Bowser. I'm the mayor of Washington, D.C., and this morning I'm going to share the latest on the district's response to COVID-19. We will provide an update on our medical surge planning and provide more information on our Reopen DC Advisory Committee. This morning, we reported an additional 51 cases of COVID-19 positive tests in the district, bringing our positives to 3,892. And we also reported this morning that 185 DC residents have succumbed to this virus. I wanted to also show you what our curves look like in terms of positive cases, and also show you the several days worth of case totals. One of our criteria for reopening is, of course, to meet 14 days of sustained declines in cases. And you can see we are not there yet. We have not begun to see a period of declines. So it continues to be critical that DC residents stay at home and practice social distancing. We also continue to spread the word about how important it is for DC residents who are having symptoms or who are in a priority group and been exposed in some way to COVID-19. We talked previously about how we are focusing on vulnerable populations in Washington, D.C., and one way to reach out to vulnerable populations was by working with those residents who participate in our Medicaid program. And starting last Friday, we also began doing ward-specific calls with council members to help us get the word out about testing. Last Friday, council members Gray and White sent out a call to constituents in Ward 7 and 8 with the citywide call-in number. And today, council members Todd and McDuffie from Ward 4 and Ward 5 will send out a similar call asking people to, if they have symptoms, if they're in those priority groups and have been exposed, to call to be tested. Again, we have focused on all of the citywide opportunities with private providers and public providers, and we're asking everybody to reach out to their provider or the citywide call-in line if they fall into those groups or areas of concern. The citywide call number, once again, is 855-363-0333. So we're asking everybody to pay close attention to how they're feeling. And starting this week, also former First Lady Michelle Obama is going to help us get the word out as well about symptoms and testing through robocalls and radio ads. I believe we can share with you a message that she will be sending. Additionally, some DC residents will receive a mailing from us that outlines the locations and phone numbers that they can call if they're experiencing symptoms or have been exposed to the virus in some way. So we're going to share that, but I just want to say that early on in our response, the First Lady's office reached out to us to ask how she could help, and I'm going to play the radio ad. Let's just pause that for a second because I can't hear it. Okay. So you'll see we're going to get that out far and wide in calls, I think radio, and we're examining how we can get that word out on social media as well. So thank you, former First Lady Obama. And with that, let me turn to our medical surge update. In total, you've heard us talk about before, we have projected needing up to 3,600 additional beds across our system, and about 1,600 of those beds will be in area hospitals, and we can accommodate up to 2,000, nearly 2,000 beds at the DC Convention Center. Already, our hospitals have added 1,000 beds, and the additional 600 beds will be ready by May 1st, and by May 8th, we will have 500 beds up at the Convention Center, and we'll phase the construction of the additional Convention Center beds along the way. Our emergency operations team is also working with hospitals to secure other contracts to make sure that we have the staff, PPE, and equipment necessary to operate these additional medical surge beds. We're also sharing here our estimates for the additional, some are thinking around the additional supplies that will be needed, in addition to this, very importantly, the staff that will be needed to staff those additional beds. To support these efforts through the Department of Healthcare Finance, we are awarding $25 million in grants to 10 hospitals. Each hospital is receiving an award on how many additional beds they are contributing to the surge. These grants were, of course, recently passed in the Council's second COVID-19 Response Supplemental Emergency Act of 2020 and can be used for supplies, equipment, personnel, the construction and operation of temporary structures for testing and treatment. Finally, I want to share some updates on Reopen DC advisory group that I announced here last week. As I shared on Thursday, Reopen DC is about working together as a community to reopen our city in a way that is safe and sustainable. We are, of course, all eager to open our schools, our businesses, and be able to get back together with family and friends. But we are all focused on how we do it safely, and we need a plan ready to go that is based on the science and tailored to the needs of our community. The Reopen DC Advisory Group will help us put that together. Today, I'm proud to share that this advisory group is being chaired by two outstanding Washingtonians who have served several U.S. presidents, including positions in the Clinton, Bush, and Obama administrations. Former U.S. National Security Advisor Susan Rice and former Secretary of the U.S. Department of Homeland Security, Michael Chertoff. So I want to thank them for bringing their vast experience to this effort and their willingness to serve their city. Along with 6 co-chairs, they will lead the Reopen DC Steering Committee, which will provide leadership to the sector committees to help evaluate community feedback, synthesize expert health and medical feedback, evaluate national and global best practices, and make sector-specific recommendations to me regarding plans for reopening. The 6 co-chairs that will serve on the steering committee are former Mayor Anthony Williams, former Mayor Adrian Fenty, Council Chairman Phil Mendelson, Chief Financial Officer Jeffrey DeWitt, former Assistant Secretary for Preparedness and Response at the U.S. Department of Health and Human Services, Nicole Laurie, and my Senior Advisor, Beverly Perry. Our chairs and co-chairs come to this project with a broad set of skills, experience, and knowledge. They all know and understand the district and are eager to get feedback from residents and local businesses. The group has a big task, and they have a relatively short time to work on it, and they are all up to it and ready to help the district respond. Here are a couple of important dates that we want to share regarding the advisory committee. This Wednesday on April 29th, the advisory committee will be hosting a virtual town hall. And this is an opportunity to share updates with and get feedback from DC residents. And more information on the town hall will be posted at coronavirus.dc.gov. And then I expect during the week of May 11th, the advisory group will submit an initial report to me, and this report will have a high-level guidance around reopening as well as some sector-specific guidance. This is a relatively quick process, but is also one that is very focused on gathering as much expert advice and community feedback as we can. So I invite DC residents to check out coronavirus.dc.gov/reopendc. Tomorrow, there will be a survey to take, and you may join us Wednesday for a virtual town hall. And Andrew Trueblood, who is the director of the DC Office of Planning, will staff the steering committee. We're supported by a number of DC government folks who will help staff those subcommittees as well. And Dr. LaQuantra Nesbitt will be the health advisor to the steering committee, and members of her team will also serve in the health advisory capacity to the sector committees. So with that, we will answer some questions. Any questions? Yes, Sam?
Yes, Mayor. Last week I asked you about the DC jail, and of course, I guess the weekend before last was a court order. Could you give us some report as to how the situation is at the jail? Last week we were saying that in some cases people said the inmates were being locked up for extended periods. I'd like to know what's the situation there. Has the city got a cleaning contractor over there? Have they named some sanitarian as mentioned in the court order?
As I mentioned, we have a team that is looking through all of the recommendations of the court, in addition to all of the things that we were already doing and continuing to make sure that those processes are not only happening, but that they're verifiable. And that we're bringing all new best practices around congregate care settings to the process as we can. So that is ongoing. Our commitment to making sure that our staff at DC Jail and the inmates at DC Jail are getting the very best in care given the unprecedented circumstances that we're all living through.
Also, Mayor, there is a halfway house in Ward 8, and I understand that the Bureau of Prisons is sending most of those people home, and in some cases, some of them are being transferred. Obviously, that has been a concern of the city. Do you have any comment on that?
I think you're referring to Hope Village, and Hope Village is a group home for people, a halfway house, and it houses, I think, over 200 people. The contractor with the Federal Bureau of Prisons indicated that they no longer wanted the contract. And the Federal Bureau of Prisons is trying to make sure that every person there has the appropriate placement. In some cases, the people are eligible for release and they have a safe release plan, and I understand that they will be released. And others are not and do not have a safe release plan, and they will be relocated to other facilities supported by the Bureau of Prisons. Our ask is that they be located in the district or as close to the district as possible. Yes.
You and Governors Hogan and Northam have been in lockstep with the closings and your reaction or response to COVID-19. I was wondering how that will apply to reopening if, let's say, for example, the district meets the metrics ahead of time before the other jurisdictions, would you reopen without them?
We certainly are going to continue to work with Governor Hogan in Northam. Our jurisdictions aren't entirely the same, but we do share this national capital region. In our view, what happens in the national capital region is very important to how well the district can continue to flatten the curve and how we will reopen. So we have conversations with the governors, and we will continue to do that.
Mayor Bowser.
Yes, sir.
You have on your Reopen DC Advisory Group as co-chairs Dr. Rice and Secretary Chertoff, and they are district residents, but they're more known in terms of a national, have a national reputation. Is there a particular reason why you chose people who have a national reputation as opposed to more local people to co-chair this group?
Well, I think that you see that we have national, global, and local. And I think you recognize that we're dealing with a local, a national, and a global pandemic. So we are very lucky in many ways to have experts, thought leaders in the medical field, in homeland security, in technology, all that we can call on to help us answer the questions of the health aspects of the pandemic, the aspects that involved emergency preparedness and response. Also, there's some level of how do we reach out around the world to be able to answer some of the questions before us. And we have the very local impacts to our businesses and workers and how we reopen. That's important. So I think that we have called on a great mix of people that embody all of those needs and have all of those experiences.
One last thing. Will they be a part of the virtual town hall on Wednesday?
We will announce an agenda for the town hall coming up. Yes.
Hi, Dr. Nesbitt. Can we get the latest hospitalization figures for COVID-19?
Which figures are you asking about?
How many are hospitalized in DC? How many of those are in ICU? And how many of those are on ventilators?
Sure. 435 individuals are hospitalized. 124 are in the ICU. And of those 124 in the ICU, 84 are on ventilators.
And then either you or someone else mentioned last week that the city was able to do contact tracing for 70% of confirmed cases. What did you learn from that contact tracing? Do we have a sense of if the people who are still getting infected with all these restrictions are essential workers or people who aren't following the orders? What are you finding?
So we do contact tracing for our high priority cases. So we are not contact tracing for members of the general public, correct? So I think we've articulated that point very clearly. So what we are able to ascertain are things around that particular population. So about 5 to 6% of our cases are in healthcare workers. As we've highlighted in our intense conversation with you all, we do see some clustering in vulnerable populations in terms of individuals in our long-term care facilities and in other congregate settings, such as those who are in low barrier shelters and have developed a lot of policies around that. We know that in the earlier days of the pandemic's impact in the district, we saw what we call case importation. So a lot of our cases, or 22% of our cases, were related to travel. Now, over time, only about 2% of our total cases have been related to travel. So the majority of the cases in the district are related to local transmission.
And do you know of those cases with local transmission, how people are getting
Because we have widespread transmission, people's sources of exposure can be a myriad of things, right? So you could have exposures from being out in community, which is why we tell people to stay home. You could have exposures from a household contact, which is why we articulate to people who are COVID positive that they need to be isolated. They should isolate at home away from others. They should have a separate use of a restroom in their home. They should, if they are unable to isolate, they need to be wearing a face covering even in the home, not sharing cooking utensils, plates, cups, or other things with people in the home. If they have to share a restroom with someone or a bathroom with some other individuals in the home, then that bathroom needs to be completely disinfected before other people use it. So those are the types of guidance and advice that we give to people. Again, last week when we changed and encouraged people, healthcare providers, to have a very low threshold for testing individuals, is that we do begin to have some concern that some of our transmission is related to household contacts. Not following some of these isolation and quarantine measures as aggressively as we would like. Yes, Mark?
A couple questions for Dr. Nesbitt. One, can you tell us how you define a COVID death in the district? I was reading over the weekend that some states are defining deaths differently. Is everybody in DC that is listed as a COVID death somebody who tested positive for COVID?
Yeah, in the district, we are only defining COVID positive individuals as those who are laboratory confirmed. Some states do transition to a process where they use what's called a case definition. So if the individuals have signs and symptoms that are suspicious, then they may call the case a probable case or a suspected case, and then they can put them in their case counts. We do laboratory confirmed COVID-19, which means that the individual has a diagnostic test that is positive. The Office of the Chief Medical Examiner, if they have someone who dies in the community or has a death that is suspicious for COVID-19, meaning that the family reports a history of clinical symptoms prior to the individual's demise, then the Office of the Chief Medical Examiner may collect specimens during their exam at the Office of the Chief Medical Examiner and do a post-mortem testing. And that individual's death may be classified as related to COVID-19. And we have had some cases that have been diagnosed or classified that way. However, we do not do COVID-19 cases based on a case definition of probable or suspected.
Thank you. And then can I ask, and I don't know, I think I'm reading the data right, that you release on the hospitals every day. It looks like last week you reported 513 ventilators available, and then today it looks like that number went down to 440 ventilators available. Is that correct? And if so, why?
We would not have had a decrease in the total number of ventilators available in our system, like the total number that are available. There would only be a variation in the number that are available, meaning patients are not on the ventilators. So we have not diminished the total available in terms of available for use.
So that number we get every day is not the total number in the city.
So the total number available across our system has not decreased, right? Like there are a total number of ventilators that patients can use. That number has not decreased since last week. We have not moved any ventilators out of the district.
I appreciate that. And then
Correct.
my last question for you, Dr. Nesbitt, is that right?
Yeah, to my knowledge, we have not moved any ventilators out of the city. We
Okay.
continue to procure more. We are expecting 93 more to come in this week.
And then there was some reporting on strokes, particularly with younger people, and possibly an uptick in strokes, possibly related to COVID. Are you tracking that here in the district? And if so, what can you tell us about strokes?
So one of the things that conversations that I've been having with the vital statistics team is how we're looking at our all-cause morbidity and all-cause mortality, and looking at some of these other causes of morbidity or mortality that are happening and how they may or may not be linked to COVID. We are looking at that issue as well as things that may be happening in the heart as well. We have not been able to observe any increasing trends in the district in particular. What happens first is that clinicians who are providing the care may see some increasing trends, and then they may be noted at the state level, primarily states that have a much larger population than the district, but we have not observed those trends in our data. We are working very closely with the clinical providers for them to be able to raise anything that is happening in the clinical environment for us to be able to see if we can observe those trends as well. But that, as well as any changes in the heart, And any diagnoses in the heart are things that are of concern to us, as well as pneumonias that may be being missed and not being diagnosed as COVID in individuals.
Mayor, I had a question for you.
Yeah.
You had been pretty clear about telecommuting continuing for as long as possible, particularly with the federal government. We hear now the IRS is bringing employees back to work. Do you know if those are IRS employees based in the district? Have you talked to OPM about that? Do you have any concerns? Do you know numbers of workers going back to
I
DC?
don't, but there will be government workers who have to do essential work. We recognize that. Just like there are DC government workers who are doing essential work and reporting to their offices or places of work, we expect that the federal government will have the same needs. Yes.
Mayor, I guess this is for Dr. Nesbitt, but I noticed overnight there were only 51 new cases. That's the least amount they've been, I think, since late March. Now, also there were only 348 tests. Why so few, and is there any explanation for the number?
I'm not prepared to make any inferences on a one-day change.
Well, there were 348 tests. That's
Correct.
Not very high.
Yeah, I'm not prepared to make any inferences from a one-day change. I'm interested in observing trends over time. And I say that, Sam, because if you look last week, we had a couple of days where hospitalizations went down, and now they're back up today, right? So our highest number of hospitalizations was 446, and then we went down for a couple of days, and now today we're at 435. So, Sam, I understand, but I'm not prepared to make any inferences about what one-day change in testing means for the district.
Yes.
Can we get any details on the death of the 17-year-old, like we've gotten in past instances about whether it was whether it was the person was hospitalized or in the community, or whether this was community transmission?
All we can say is that we got this report of a DC resident who died in another state, I believe Pennsylvania, and I think we didn't get it in enough time to find out anything more. So the more we find out about that, we'll share. Yes, Amanda from the City Paper.
Hi, Mayor. Thank you for taking my questions. I just have two today. My first is, how many healthcare workers have tested positive for COVID-19? Are any medical facilities short-staffed due to the number of cases?
I don't know if we have a number for all of the medical or healthcare providers, especially since some of them present in other jurisdictions. I think what we can share is our healthcare providers at St. Elizabeth's or at FEMS, and those are the numbers that we have to share. Dr. Nesbitt, do you have anything to add to that? And we can provide that FEMS information, and in also United Medical Center, we will have United Medical Center, St. Elizabeth's, and FEMS.
Well, the public safety together, so MPD as well.
Oh, and all of our first responders. What was your other question?
Thank you. My second question is, Washington Legal Clinic for the Homeless sent a letter to your office on Friday requesting that every person experiencing homelessness be offered a private, non-congregate setting like a hotel room, given some clusters we're seeing in shelters and a spike in overall cases. So I wonder what you make of clearing traditional shelters.
And Chris,
Thank you.
Director Geltart can talk about how we are working with our shelter population.
Sure. And we look at the shelter population much as we do the population of the city. So in that, we are encouraging those in the shelters to stay in the shelters and not be out in areas where they can potentially see exposure. And we are monitoring those in the shelters to ensure that if we see signs and symptoms, just like you would in your home, that we're getting those folks tested immediately. And then if they become positive, we are providing hotel rooms for them to convalesce in, and that's our process that we're following right now.
Okay. Steve from the Washington Post. Steve?
Can you hear me okay?
I can hear you.
Okay, thank you. I'm wondering if you could talk a little bit about the number of labs and the capacity within the district to do diagnostic testing, that capacity versus how much of that capacity is being used, and if it's not all being used, if there are any shortages or other reasons for the capacity, that we're not using using as much diagnostic testing capacity as we may have, if that's the case.
Thank you. So I want to mention that Dr. Nesbitt and Dr. Smith, who have presented here before, are very focused on the district's capacity, our strategies for testing moving forward. They are participating in regular calls on testing with our federal partners. We also recently had a call with Dr. Fauci talking about what's happening on the ground in DC and getting any additional feedback. So I'm going to turn to Dr. Nesbitt to just give you a quick but a comprehensive summary about where we are.
Thank you, Mayor.
Thank you.
So we've done a great level of assessment of the testing capacity in the district. And at a high level, what I will share is that we have one public health laboratory in the district and 6 clinical laboratories, which are in our hospitals, our acute care hospitals, and then 1 research laboratory in the district that all have the capacity to provide diagnostic testing for COVID-19. They test for the virus SARS-CoV-2. All of these laboratories have a number of testing platforms that can run these tests. Combined, they have the capacity to run, their instruments or testing platforms have the capacity to process about 3,700 tests per day. Unfortunately, through a number of challenges in the supply chain for reagents, they are limited to only being able to process about 1,500 tests per day. So that's if we're just talking strictly about the reagent capacity for testing in the district. So the platforms themselves can run about 3,700 tests, but the laboratories themselves, the operators of the laboratories, through a number of supply chain challenges, the vendors who operate these platforms and make these platforms are only making available about 15 reagents for them to run about 1,500 tests per day. That being said, tests can only be processed if the clinicians who do the sampling have the sampling kits, meaning the swabs, the viral transport media that they need on the front end to be able to collect specimens from their patients at a number of locations. You've heard the mayor talk about the number of public testing sites that we have throughout the district where people can go and have a specimen or a sample taken to send to these labs. So there are some barriers on the front end. The sampling kits, meaning the swabs and the transport media, are limitations, as well as the amount of personal protective equipment that is required for sampling to occur. So in theory, there are enough testing platforms to run 3,700 tests per day in the district. There are reagent limitations that bring that number down to 1,500 tests per day. And then when we get into issues of sampling kits and PPE, that number potentially becomes even lower.
Thank you. That's very helpful. And I'm wondering if are the swabs and collection issues, are those a limiting factor currently, or do we have enough for everybody that's coming in right now, or everybody that meets the requirements or criteria?
Well, I'm just going to use our citywide sites as an example, and we have capacity for more people who fall into the testing categories to go to those sites. They're not limited in the number of people that they can see by supplies. But we want to make sure that people know that they can go for free testing at those sites. And Dr. Nesbitt may want to comment more on what we're seeing across our private providers.
Yeah, so the mayor is absolutely on target that the way that the current testing system is set up is that we marshal so many of our supplies into these testing sites. Like the district site, we're absolutely prepared to see 300 people a day at our sites at UMC and Bertie Bacchus, and we want people to call us at 855-363-0333 and come into those sites. It's critically important that if you want to be tested, you know that we have the capacity to test you. And there are many other sites throughout the city. Those sites are listed at coronavirus.dc.gov that have the capacity to test you as well if you call them and you get an appointment. The challenge that is before us is as we move into the phases of reopening is making sure that we have the sampling kits and supplies in a host of other locations throughout the city so that your regular doctor also has the supplies and the sampling kits and the personal protective equipment to be able to test you. So as we have this local conversation, this national conversation about expanding access to testing, it's not only about whether or not we have the supplies at our district-sponsored testing sites, but that every healthcare provider in the city who desires to sample and test their patient has the same capacity and ability to do so.
Okay, thank you. Alex, CNN.
Mayor Bowser, thanks so much for taking my question.
Yeah.
I wanted to follow up on Ambassador Rice and Secretary Chertoff. You mentioned that the First Lady herself, her office, reached out to you. Can you talk a little bit about the outreach to those two, to the co-chairs? And to my colleague's point about their previous experience being more global and federal, what exactly are you expecting from them in these roles?
As I mentioned, Alex, that we are expecting them to provide leadership to the sector committees, to synthesize the information that we're getting from health experts and develop recommendations around reopening across the sectors, to also pull in from their vast experience and networks global best practices that can inform how we move forward. And over the course of my time as mayor, I've had the experience of talking to these leaders in a couple of capacities. First of all, Ambassador Rice, she's a hometown DC leader, and she loves DC and supports us locally and has always done that. And when we're able to go back out to the Palisades Parade, I expect that you're going to see her walking with her neighbors. But more than that, Ambassador Rice, as you know, has been around the world and in her leadership positions, and is prepared to bring that type of experience and vision to this process. Similarly, Secretary Chertoff has helped me, for example, when we are dealing with Homeland Security issues and we were recruiting our leader and Director Rodriguez. I was able to get to know him and his understanding of Homeland Security measures. So he's going to bring a different set of skills to this leadership position. And so that's what we expect for each of them to offer. Yes.
And just in terms of how you roped them in or enlisted them, how did that process play out?
I called them and I asked them if a lot of people in DC have had this experience. I'll send them a note and say, I have a great opportunity for you to serve your city. Can I call you? And I think that's how both of those conversations started. We had a conversation, and pointed conversations, let me tell you. These are people who are used to getting things done, having what they need, working with tight time frames, working with experts and professionals. And that we, working with them is adding just another tremendous layer of expertise to our process. So that's how those conversations began. Yes?
To follow up on this Reopen DC group, so if they're issuing recommendations on May 11th, it sounds like you won't make a decision on whether to extend the emergency or restrictions beyond May 15th until closer to that date and that week.
We expect to follow the Reopen Committee. Let me be clear. They are going to be making recommendations on how we open. Our recommendations about when to reopen, we are going to rely on our health experts at the Department of Health. And I don't know exactly when we will be able to say what that date is.
Okay, so this group isn't going to be recommending a date for you, but more the process. Like, if we reopen restaurants, let's start with social distancing and then.
Exactly. And additionally, I expect that they will also be pulling together a toolbox of resources for people in the various sectors, for businesses, workers in those sectors. And organizations, and a lot of this activity also includes government, schools, and you notice that we have a committee that focuses on human services and social services and health, another on government operations, public safety, and criminal justice. So we will continue to look to this group for recommendations on how we safely reopen.
You reach out to Fenty, or did he reach out to you? And is he back in DC now?
I reached out to Fenty, and he lives, I think, in 2 places. Yes.
Mr. Mayor, you mentioned you're splitting $25 million amongst 10 hospitals. Are they all in the city?
Yes.
They are.
Yes.
Yes.
I'm sorry. Go ahead.
So, Sam, just as a note on that, in case you're doing the math in your head, we actually classify about 13 hospitals in the district. We talk mostly about the 6 acute care hospitals, but it's important to note that we have specialty and subacute hospitals in the district. So think about Psychiatric Institute of Washington, Bridgepoint. Those are hospitals in the district. That's okay. I saw, I saw your head going. I want to make sure we classify it. Yeah.
Can we get the chart of hospitals and how much money they're getting emailed?
Yeah, we were released. Yeah.
Yes.
So if, when you do get ready to reopen the city, will it open all at the city as a whole? Or what if one quadrant or one ward has much better or much worse numbers than another segment of the city? Do you envision the possibility that, for instance, like New Jersey has north, middle, and south regions? Do you envision opening up the whole city together, every ward and every quadrant? Or is it possible that if some wards have better numbers than others, there might be different?
We haven't gotten that far in our thinking, but I think that would be highly unlikely, that we would have a different policy for Northwest or Ward 3 versus Southeast and Ward 8. I think that would be unlikely. Okay. Thank you, everybody.